So this patient had an epidural steroid injection a little over a week ago. He's overall improved. However, he still has some pain that he localizes to the paravertebral space around the L5-S1 facet joint. So I'm just going to scan. What we see here is the spinous process of L5, and when I go laterally, I can see the facet joint on the corner, and sometimes it's a little harder to see the transverse process. What you see here, though, is the PSIS, this large bone to the side. Typically, at the level of the PSIS, you can see the S1 foramen, which is right about here as the bone disappears in the center. Now I'm going to reverse the orientation of my ultrasound so that the right side of the patient is on the right side of the screen. And I'm going to come laterally. You see the spine of the L5 vertebral body and then the lamina to the right. And at this location, I'm going to angle it upwards to see the facet joint, because if I come directly transverse across, the PSIS will be in my way as such. See? This is the PSIS coming into view. So if I'm coming to the L5-S1 facet joint, I'm going to angle upwards to get over the iliac crest. Chuchu balit. Little pinch. And I'm coming into the bone right here, and I just landed on the bone. It's basically on the facet joint. I'm going to aspirate and inject about 1 milliliter in the region. Now this is not the same as a fluoroscopic guided joint injection, in which we use contrast, but just getting the medication around the joint between the multifidus and the lamina and at the capsule will give him some relief.